So good morning, good afternoon, good evening. Welcome to a very special EPI-WIN webinar today. It's on ship inspections and issuance of ship sanitation certificate. For those of you who are unfamiliar with EPI-WIN, it stands for WHO Information Network for Epidemics, and our goal is to share knowledge and for evidence-informed actions for health emergencies. Today, this is particularly important because according to the International Health Regulations 2005, where the amendments were done and came into force on 19 September 2025, all state parties are required to strengthen, maintain core capacities at designated points of entry to manage routine public health events and respond to public health emergencies. The issuance of ship sanitation certificates is therefore critical, and therefore this is a very important EPI-WIN webinar. And that is why it's going on for 3 hours over 2 days, rather than the usual 1 hour thing. And I hope all of you will find it useful. Although it's focused particularly for port health officers, it's open to everyone who might be interested. Before I hand over, a quick run through what we're going to have today. We're privileged to have Dr. Stella Junglong, a Director of Health Emergency Preparedness Department, to provide the opening remarks. Then Dr. Ninglang Wang, Head of Borders and Mass Gatherings, will provide an overview of the international legal framework for ship inspections, and followed by Dr. Sarah Barragan-Montes, who will provide the IHR list of authorized ports to issue ship sanitation certificates. That gives the overview and background. We will also have interactions and hear from you through polls. Then we go to the practical applications. We have Thijs Veenstra, Senior Policy Advisor in the Netherlands, who will provide the country case study. Then we'll have a discussion and Q&A and a short break for you to recharge. Then we have Dr. Martin Walker, who's from the UK Independent Points of Entry Specialist. We'll talk about pre-inspection, planning, equipment, and administration arrangements. Followed by him, we have Dr. Barbara Mochuri, who's a Professor of Health, Hygiene and Epidemiology at the University of Thessaly in Greece, who will talk about risk assessment and control measures for different vessel types. Then we have Dr. Yahya Alamis, who's the Manager for General Directorate of Health for Borders and Coasts in Turkey. He will give you a presentation on the issuance of a ship sanitation certificate and the evidence report forms. Finally, we also have another practical country case study from Morocco with Dr. Leila Bouziani. All of these will be interspersed with discussions, Q&A, and polls. So all of you are part of this webinar and will be contributing to it. Then we have the closing for today by Dr. Ninglang Wang. So quick housekeeping, this webinar is being recorded and the recording will be put up on our website. So if you've missed something, especially since this goes on for 3 hours over 2 days, you will get the recording. Don't worry about that. The usual, we'd love to hear from you. So introduce yourself in the chat, but please put your questions in the Q&A box, not the chat, because that's how we can keep track of your questions. Please, I think to this audience, I don't need to say that, but in general, the principle for EPI-WIN is to keep all comments respectful and to the topic. And with that, I hope you will really find this a very fulfilling and useful webinar, and I invite Dr. Stella Junglong to provide the opening remarks. Over to you, Dr. Stella.
Thank you, Jim. Dear colleagues, dear speakers, dear partners, good morning, good afternoon, good evening, wherever you are across the world. It is my singular pleasure to welcome you to this webinar on the ship inspection and issuance of ship sanitation certificates. Today, we bring together port health officers, ship inspectors, and public health authorities from across the African, Eastern Mediterranean, and European regions, and beyond. The diverse participation reflects our shared commitment to the implementation of the international health regulations. With the amended IHR, now in force since September 2025, there is a renewed emphasis on strong, sustainable health capacities at points of entry and conveyances. The capacity to conduct ship inspections and to issue ship sanitation certificates remain a cornerstone of this effort. These are not simply administrative requirements. They are critical operational tools that prevent the international spread of diseases whilst allowing global travel and the supply chain to function safely. A standardized high-quality inspection system across the world is essential. It provides a consistent, globally recognized approach for assessing, documenting, and communicating public health risks on board ships worldwide, helping countries to detect risks early, to prevent outbreaks, and to maintain confidence in maritime traffic, which is an indispensable part of the global economy. The ability of the port health authorities to carry out these inspections effectively and issue ship sanitation certificates in line with the international health regulations is therefore an essential core capacity. At the time when we look into these issues, we fully recognize the operational realities that many member states face: limited resources, high staff turnover, other competing priorities, amongst others, that can affect the consistency and sustainability of implementation. These challenges are real and they are shared across regions. This is precisely why today's webinar and its continuation tomorrow is so important. Over the next 2 days, our goal is to support you to improve your technical capacity by sharing key WHO's guidance, by translating requirements into practical experiences that work in real port and ship settings. You will hear directly from experts and from country representatives who have developed effective and sustainable approaches. In this regard, I would like to sincerely thank the representatives from Morocco, the Netherlands, and Tanzania, who will share concrete experiences at the country level. We hope that this platform will support a more harmonized, confident, and sustainable approach to this technical area. Thank you once again for joining us and for the crucial work you do every day to protect public health at the front line of maritime traffic. I wish you a successful webinar today and tomorrow. Thank you.
Thank you. Thank you very much, Dr. Stella, for providing an overview and welcoming all the participants to this important webinar. Now I would like to request Dr. Ninglang Wang to provide an overview. Over to you, Dr. Ninglang.
Okay. Thank you. First and foremost, thank you so much, Dr. Stella, for this very warm welcome and for setting the stage for this important topic. We know that ships come to our ports that bring the passengers, bring the cargoes and goods, but it also brings a chain of public health responsibilities that connect the public health authorities, the conveyance operators, and travelers. And I do not know if you know this, in the amendments of the International House Regulations, and there's a new introduction of in the purpose and the scope, which means the prepare for. So that was the word not included in the past version, the 2005 version, but with the amendments that includes. Actually, that I think this is the essence of today's webinar, because and in relation to this topic, because we're looking at how to establish a system, procedures, capacities, including the trained experts, and to engage this area of work, which is an important piece of the preparedness. And I'm very happy to have our department director from the Health Emergency Preparedness. So that really reinforced the importance of this area of work in terms of the preparedness readiness. In order to get into the details for the 2 days of that webinars, I would like to have a quick revisit of the International House Regulations and its evolution, because this is so much relevant to the topic. It basically determines the requirements that are mandated for the countries to build the system, procedures, and capacity for ship inspection and the issuance of ship sanitation certificates. So you have seen that on the slide, we have seen our quick evolution of the different versions of the IHR. And you know that since the September of last year, the IHR 2024 amendments have been entering into force. So this is an important milestone. I hope that we all can bear that in mind, because with that evolution of the amendments, the set of the requirements for ship inspection and the issuance of ship sanitation certificates not only retained, but more reinforced. I think that you will see that from these 2 days, all the different presentations from WHO experts, from country experts, through revisit of WHO guidance and the country case studies. So you will have more better understanding, more deeper understanding of these 2 days. Now, let me get into the real legal provisions of the RHR in relation to this area of work. I will start with the RHR Article 20, with 20.2 and 20.3 that outlines the requirements. These ship inspection and issuance of ship sanitation certificates, these certificates need to be issued in accordance with the requirements in Article 39, which I will detail in the later slides, as well as the model provided in Annex 3. What does that mean in our practical life? That means that the certificate has a standard template. We cannot use a self-made template because it's a global recognized certificate. So we follow the standard template that has been provided in the RHR. And state parties should send to WHO list of ports authorized to issue different types of certificates. I will not get into details because my colleague Sarah will give you a full rundown of this requirement and how to fulfill this requirement. Now, what I wanted to highlight is for this list of authorized ports, if country has any change in terms of the status of these authorized ports, they need to communicate with WHO, because this is our official reference for the ships, for the ship captains, for the authorities, health authorities in the country to check whether the certificate is issued by our authorized ports. So this is important reference. If any change, please communicate with WHO. And if our valid ship sanitation certificate, regardless its exemption certificate or control certificate, is not provided by the shipmaster to the ship inspectors, then this ship can be considered as an affected committees, which is subjected to the follow-up ship inspection and perhaps health interventions that ship inspectors may require the ships to conduct. Now, coming to the IHR Article 39, this basically is the article set out all the detailed requirements in terms of that certificate, the points that we wanted to strike in order to better understand this, the notion of the ship sanitation certificates. You will see here, first, the certificate only valid for 6 months. So every 6 months, the ship need to require to renew the certificate. And what is the standard process of that in terms of inspection? I think you have definitely come across thousands of times in your professional life as our ship inspector. So I think that you know very well the process. Basically, the certificate, whether it's a new ship to request a new certificate or renew of our existing certificate, this has to be issued after a full inspection of ship. So there are many technical areas in the ship. If you are familiar with the WHO handbook for ship inspection and issuance of ship sanitation certificates, that book in the part B outlines all the technical areas as a ship inspector you need to look at when you engage in the ship inspection. And not limited to the presence of rodents. Even after so many years of entry into force of the International House Regulation, we still found out sometimes some ports still issue the D-rating certificate instead of the ship sanitation certificate that cover all health hazards. So whenever we have received, the copy of the D-rating certificate, we contact our regional focal points and ask them to convey that to the countries so the country can take corrective actions. So if any of you still have that D-rating certificate practice, please refer to the those provisions and the WHO handbook, so you will get more knowledge and the practice how to transform that practice. Now, for the SSC, we see, as we mentioned, this is a global recognized tool and a standardized way to detect, to record, and communicate the public health risks across the world. So this is a very useful tool for the global surveillance and the risk reduction in terms of maritime traffic. So this is why this certificate was born in the context of the International Health Regulation. Types of certificate, I will not also get into details because I know my colleague Dr. Yaya will also provide a comprehensive presentation in terms of the issuance of ship sanitation certificate, but I will just touch the surface in terms of the condition to issue different type of certificates. And I wanted to clarify also one point. Some of we have seen from our past operations, some of the ports are still have that a bit confusion in terms of how many types of the ship sanitation certificates we have. I wanted to clarify, we have 2 types of certificate. One is the ship sanitation control exemption certificate. The condition to issue that is when you have done a full inspection of ship and there's no evidence of public health risk is detected on board. And you are satisfied that ship is free from any infection and contamination in terms of hygiene and sanitation, including the vectors and the reservoirs. And then in that condition, you issue the ship sanitation control exemption certificate. Another certificate type is the control certificate. So that's when there's evidence of public health risk, including any source of infection and contamination is detected. And when you prescribe the health control measures to contain that health risks that you just detected and the results are satisfactory, and then in this case, control certificate is issued. Now, the confusion many times lie in this extension of ship sanitation certificate, which is not a type of certificate. It is a measure, basically, to enable a ship getting to a port where the port is equipped to inspect and and apply the health intervention if their public health risks are detected on board. So sometimes a ship calls at the port and their certificate almost almost approach the expiry date. But then the port they are calling at is not equipped to provide that service. So what the port can do, they can stamp on the existing ship sanitation control certificate or exemption certificate and to extend 1 month. So in that condition, the ship is able to reach a port, next port of call, who can provide this service. So this is just in very specific circumstances. So this is not a different type of certificate. It's just a measure, conditional measure, when this specific instance just come to the ship. Now, I wanted to also touch upon 2 articles which are not directly linked to the shipping inspection, but they are associated with the country's obligation, which is the Article 24 and Annex 4 that are talking about the roles and the responsibilities for the conveyance operator. As we said, that the shipping inspection is a connection point between the health authorities, conveyance operators, and the travelers. Each has a role to play. So here, Article 24 and the Annex 4 set out the requirements for the conveyance operators. So in essence, they need to cooperate, they need to comply with the recommendation issued by the countries. They need to facilitate the inspection of the conveyance, cargoes, and goods. So that's also very important legal provisions that we need to be aware, because that can be our legal argument when we engage the conveyance operator. Another article, Ship Declaration of Health, which was called the Maritime Declaration of Health in the version of the IHR 2005. This is the amendment that has been entering into force since September of 2025. So what's the reason we changed that Maritime Health Declaration of Health to Ship Declaration of Health? This is just really to precisely to reflect the nature of this form, because this declaration of health really focus on shipborne risks instead of looking at the maritime in general, which includes the ports as well. So I think with this change, that is more precisely reflected the nature of the form. And between the Ship Declaration of Health and the Ship Sanitation Ship Sanitation Certificate, they are complementary to each other, that to give a really real-life screenshot of the hygiene sanitation conditions on board of ships. Moving on to another set of requirements, which is really the role of competent authority for points of entry and Annex 1B core capacities. The reason I wanted to quote these 2 and I wanted to share with you, because that's the articles of the RHR really set forth in requirements for the countries to meet. We need to have that capacities and train the personnel to engage the shipping inspection. So I circled, highlighted the requirements that are very much related to our obligation, country's obligation to provide the capacities. And then Article 22, you will see that across all the different sub-provisions, there are many texts related to, as are competent authorities for points of entry, you have a role to play in terms of ensuring the free of infection and contamination on board the ships. Then I also wanted to speak a few words of the shipping inspection, SSC training. Since this shipping inspection and issuance of ship sanitation certificates provides a tool as a surveillance and a risk reduction for the maritime traffic. And in the meanwhile, we wanted to ensure those health interventions is risk-based, evidence-informed, and so they do not unnecessarily disrupt the maritime traffic. So we have a WHO training package that includes online training followed by face-to-face training. And we have a pool of experts with WHCCs and with experts actually who you will listen to their presentations. They are part of our pool of experts. And there are also training opportunities across regions, countries we all can tap into. This is the online training where you can find in this health security learning platform. We have many language versions. So please feel free to raise the request to your country offices and regional offices, and we will share the relative materials with you for you to access. A quick overview of the SSE online training enrollments. You can see right now, basically across the world, we have majority of the countries have already got the the ship inspectors that have been trained. So I will encourage you also to submit the training request, and we'll be very happy to provide that assistance. Okay, so now come to almost my last slides, a few takeaway messages. Even I know many of you know by heart, it doesn't harm that we always, revisit those language, those messages, so we can use that in our day-to-day life. One is SSC applies to all ships in international voyage. So not only for the sea, maritime seawater, but also include the inland waterways in the international routes. So we know there are some rivers, lakes that were connected to many countries. So this SSC apply to all ships. If they're navigating in the inland water, they need to also to request the ship sanitation certificate. Sorry, and this certificate entering into force since 2007. Again, replacing all D-rating certificates. So D-rating certificates is no longer existing. This is an obligation for the master to provide a valid certificate on board. Otherwise, the ship can be considered as affected ship. And the certificate should be issued only after a full assessment of the hygiene and sanitation condition on board. And the model has to follow the IHR Annex 3, otherwise the certificate can be also considered as invalid. It should be issued by authorized ports and only valid for 6 months, with a possible 30 days extension in some specific circumstance. So with that, I think I will close my presentation. Just want to say the ship sanitation certificate is not just a paperwork. It is a standardized system for surveillance and risk reduction for the maritime, for safeguarding the maritime safety. So thank you very much. With that, I will pass the floor to Supriya. Thank you.
Thank you very much, Ninglan. So next we will have a pop quiz just to see if you have been listening closely to the previous presentation by Ninglan. We will give 30 seconds for you to answer, after which I'll hand it back to Ninglan to reveal the answer. So you should probably be seeing the question pop up on your screen. Okay, we're seeing more than 120 participants have already answered. So we'll give it 5 more seconds before we end the poll. Great, and we have more than 200 participants who have answered now. Okay, so close to 50% response rate. I will now end the poll and share the results. So now I'll hand it over to Ninglan to reveal the correct answer.
Thank you so much, Sophia, and the colleagues whoever responded. So the correct answer is September 2025. So congratulations for the colleagues who responded correctly. And we have 2 days, so I'm sure that the other 37% of the colleagues will get the right answer after the end of the webinar. Thank you so much.
Thank you very much. Huge thank you to Ninglang and Sophia and all the participants for the poll. Now we move on to Dr. Sarah Barragan-Montes, who will give you the WHO IHR list of authorized ports to ship sanitation certificates. Over to you. The floor is yours, Sarah.
Thank you very much, Sophia. Colleagues, warm welcome from my side as well to this webinar. Very happy to see so many people joining. I'm going to be providing a very short presentation about the WHO IHR list of authorized ports. The aim of this presentation is really to provide the key messages about how this authorized ports list works, and also hopefully answer some of the questions that we most frequently received from countries. During my presentation, I'm going to touch upon first, very briefly, on the legal requirement. What is the IHR provision that allows us and mandates us to do this work? Then, with regards to the IHR list of authorized ports, I will cover what its scope and objective, and most importantly, how do you access information about the authorized ports in all states parties across the globe, and how do you update information, if you're authorized to do so, for your own authorized ports in your state party. Finally, I will mention a few remarks with regards to some work that we are doing on a regular basis when we receive invalid certificates. First of all, with regards to the legal requirements, this work is embedded within Article 20, Airports and Ports, and in particular, paragraph 3. So this is the paragraph that represents the agreement among all states parties of the IHR, that ask for each state party to send to WHO a list of ports authorized to offer the 3 different types, or the 2 different types of certificates, and the extension of the ship sanitation control exemption certificate, as well as to provide the services referred to in Annexes 1 and 3 when it comes to a ship sanitation control certificate. As well, this article mentions the obligation for WHO to publish this information so that it's publicly available to all the states parties. And this information should be kept regularly updated. You may see here highlighted in red a couple of brief sentences in this article. You can see the terminology "shall," which in legal terminology means there is an obligation. So indeed, the states parties are obliged to send to WHO this information, to keep it updated, and then WHO is obliged to make this information publicly available. Now, how do we do that? The answer is through the IHR list of authorized ports. What is the scope and objective of this list? As we have heard already, ship sanitation certificates are the globally recognized tool that promotes common health standards on board ships. They provide a common way for us to register and communicate across all ports across the world and among all the stakeholders that are involved in this process regarding any public health risks that are found during an inspection, and also recording any control measures that have been applied to manage those risks. In that regard, SSCs contribute to minimizing the risk of international spread of diseases via maritime traffic. But most importantly, only those ship sanitation certificates that are issued by ports that are authorized by national health authorities to do so are considered valid. How can you make sure that a certificate is valid? You can check whether it's issued by a port that is included in the IHR list of authorized ports. How can you access that list and the information about the authorized ports for all states parties? There are 2 main ways of doing so. The first one is through the WHO webpage, this link that you can see available in the slides. You will see a screen that looks more or less like this. And then you scroll down. This is our webpage where we include all information related to border health and points of entry from WHO. And when scrolling down on the web page, you will find a section that looks like this one, the list of ports that are authorized to issue ship sanitation certificates, and a big bottom there search tool, which I have highlighted with a red arrow. You click in there and you access directly into the list. Another option is just to go directly through the link of the IHR list, which you can find in this slide here. And through both options, you will end up in a screen that looks like this. This is the webpage of the IHR list of authorized ports. It's a very simple database, and it will allow you in the field to type the name of any country and to access the information on the authorized ports for any country, any state party. For the purposes of this presentation, I decided to choose the Netherlands, which is the first country case study that we will have, just to show you how it would look like if you type Netherlands into this database. As you may see on your screen, you will have all the names of the different ports that the authorities in the Netherlands have authorized. You will have the codes for the ports, and then you will see 3 columns with the different types of certificates or extensions, and you may see whether each port is authorized to issue one type of certificate or several of them. You also have 2 options on the right-hand side that I know port health officers use very frequently, which is the option to download the list for the country or the entire list for all countries, both in PDF or in an Excel file, so you can have it readily available during your work. Now that is to access information about authorized ports in all states parties. What about updating the information for the ports in my own state party? That is a different web interface. All national IHR focal points have access to this web interface, and you can see the link to it here on the slides. This web interface allows us to update and keep updated information about our authorized ports, but also we understand that sometimes national IHR focal points at the national level decide to decentralize some of the data management for this database. And in that web interface, you can delegate data management. So for example, in some decentralized countries, we know that the IHR NFPs decentralize the data management of specific ports to the subnational level. All of these options are available through this web interface. If you enter into the web interface and you have the access to it, then you will see a screen like the one you will see now in your screens on the right-hand side. You just have to include your email address, then copy the text that you can see highlighted for security reasons and click continue. You will be directed to a web page that looks like this. Again, only if you have the access to the web interface. In this web page, there are 4 key sections. First one I have highlighted in red, it's the dashboard. In this dashboard, you will see a summary of all the information about your authorized ports within your territory. Second one is POE management. Here is where you can manage and update information specific to specific ports that are authorized within your country to issue SSCs. Next is group management and user management. I have highlighted it here in yellow. These are the sections where you can, on the one hand, create groups of ports. So for example, if the given country is divided into different sub-regional entities that have several ports, you can group them. And then the other thing that it allows you here in the user management is, as I mentioned before, to delegate the management of the data. If you decide to do so, to delegate some of the responsibilities for data management, you have a section at the end of the screen called modifications pending approval. Here is where you can see, in this case as national IHR NFP, you can see the progress on the data management that you have delegated and approved it when it comes to time. Now, just a few words on invalid certificates that we also wanted to inform you about in this webinar. With the great cooperation of many of our border health authorities, port health authorities that we are regularly in contact with, we from WHO headquarters, the border health team, we're doing a regular collection of all the invalid certificates that are sent to us. We do that with the aim to rectify the situation so that hopefully we start to see less and less invalid certificates. That's our aim. We collect this information regularly when it comes, and then through our network of WHO regional and country offices, we share this information with the concerned state parties to rectify the situation. So for example, if it is an invalid certificate because it doesn't follow the correct template, we will engage into conversations with the country about this. Or if it is a case of a certificate that follows the template, but the port has not been authorized in the list, we just make sure that, that it is well reflected so that we are not creating these misunderstandings between the different countries. So we do this regularly. As I mentioned before, the IHR NFPs, the state parties, have the option to update and keep updated their information on authorized ports directly into the web interface. However, if you encounter any problem and we can help you to overcome your challenges, we are always available at the email address that we have included in these slides. You can contact us there and we will help you to resolve any issues with regards to your database. With this, I finish my presentation. Thank you very much to everyone, and over to you, Supriya.
Thank you very much, Sarah, for that very informative presentation with a lot of very practical information. On that note of practical information, I would like to invite Mr. Thijs Winstra, Senior Policy Advisor, Coordinator for Infection Prevention and Points of Entry in the Netherlands, to give us practical application in the Netherlands. It's a country case study. So the floor is yours, Thijs.
Thank you very much. Thank you for the opportunity to share some information about our situation in the Netherlands. Can you see my presentation clearly? All right. I've prepared this presentation together with my colleague Tanja Hartog, who is our senior inspector and national trainer. And I'm Thijs Veenstra, working for the Infectious Disease Department of the National Institute of Public Health. Just a few statistics. We see a lot of ships in the Netherlands. We have 16 seaports, and altogether we see over 35,000 ships, and the majority is in Rotterdam, which is a very big port. And to give some statistics, there is 593 million tons of goods. And if you see the statistics over to the right, then you see that we are one of the top of the Netherlands. This chart is in weight, in tonnage, and that's why you see Norway with its iron ore, which is very heavy, surpassing us. But economically, Rotterdam is an enormous port in the Netherlands. It used to be one of the biggest in the world. And that's also the reason we have a lot of issuance of certificates in the Netherlands. On the left, the exemptions we issue, and mind the y-axis. So the differences are not as big as you may think. About 2,500 to 3,000 certificates every year, and the vast majority is exemption certificates, and a smaller proportion is the control certificates. We do not hand out control certificates easily. We try to correct as many deficiencies as we can see in a good cooperation on the exemption field, but sometimes we have to hand out the control certificates, of course, as well. Altogether, 2025, almost 3,000 inspections were carried out. The Kingdom of the Netherlands, there's a few special sides on it. Under IHR, we, of course, are responsible as well for our municipalities in the Caribbean region. Those are 3 islands where also ship sanitation activities take place, and 3 autonomous countries, Aruba, Curacao, and Sint Maarten, who are countries within the kingdom. So in terms of IHR, we are together. National coordination of ship sanitation certification. It is a point of interest. I'm working for the National Institute of Public Health and the Environment, and we are responsible for IHR implementation. So also for the implementation of the issuance of ship sanitation certification. We support ports, municipalities, when they have a wish to become a designated port, or a port where certificates can be issued, and for the implementation of the inspection task. So that means we take the initiative of making sure that the inspectors, the regions, are well prepared for carrying out the task. So that, of course, includes the training of inspectors, but also peer support. When inspectors encounter difficulties on the job, questions or things that they want to discuss, then we always make sure that we are available, or that other experienced inspectors are available. And this is our first step in supporting uniformity in the issuance. But I'll get back to that later. So we are organized through municipal health services. All in the Netherlands, it's 25 regions who are responsible for public health, for infectious disease control, and also for prevention and IHR activities as the issuance of certificates. And 8 of these have a port. They are now in yellow. In all these regions, there is a port. And there, the infectious disease control department is also responsible for the issuance of certificates. This is not a port health separate organization. This is part of the regional organization who is responsible for general public health, also having this task in addition because they have a port. And together in the Netherlands, we have 30 trained public health professionals who are basically all trained by my colleague Tanya, you can see now, and who is there today in the panel as well. We organize through municipal health services, so we do not have a dedicated port health organization. There are some challenges come with that. Only Rotterdam is big enough to have a dedicated team of inspectors who focus solely on ship sanitation certification. Only in Rotterdam that can be done. In all the other parts, inspectors do inspections as a small part of their workload. So they have for the municipal health service a set of different tasks, and only one of them is ship sanitation certification. And keeping the level of knowledge up to par for this very specialized task, that's a challenge. And I'm not quite sure that many people will recognize that. It's not something that looks anything like shore-based jobs. Ship sanitation certification requires very specific expertise. Recruiting inspectors from within the municipal health service is also difficult. It's not as easy to find people who are willing and fit for this task. Well, an important part, training and practice. We have our system for training. We always start with the WHO e-learning, of course. We're very happy it's there. We give all inspectors a face-to-face training, which is 2 days, but we start this twice a year. So there's 1 day in the first half year, there's another second day in the second half year. So you can start at any moment, and you might encounter a training in a different order. And we make sure there are practical arrangements and assignments for each day so you can prepare. So we ask these inspectors to have some experience, to have co-inspected when we train them. And we end with 1 day of practical training in the port of Rotterdam, where training on the job is performed. So there's a set system where we can be sure that every inspector has been trained at least through this online training, the assignments, the face-to-face and the practical training, to make sure that we fulfill responsibility and we can make sure there's as much as uniformity in inspection as we can achieve. For all the other inspectors, we have a yearly seminar. Once a year, we collect all our inspectors and we share experience, we share new information, we discuss difficulties and topics. This year, of course, we will discuss changes in IHR, for instance, and this is our main way of supporting uniform quality of inspection. Once or twice in a year, we add a webinar for our inspectors when there's anything in addition we would like to share or discuss with them. We support shadowing each other during inspections. So an inspector from one port inspecting together once in a while with an inspector from another port. We think this is very useful. The feedback we receive is always that it provides a lot of insights, and I highly support to do this, but it takes time, especially when inspectors are on call, are having their duties, are difficult to plan. Also, the shadowing is difficult to plan, but still, it's a best practice that is really insightful. So I would support to do this. Well, when it's about uniformity in inspection, we notice that there is quite some differences along, or even around the planet. We notice this in different ways, different approaches. There might be cultural differences to the approach of the inspection, or the circumstances, and the financial leeway that's available. So we support very much the initiative of supporting uniform inspection. We think it's important, it's a responsibility, but at the same time, we do see it's different and it's difficult. In the Netherlands, we created a point of entry network. We did that after the pandemic. Network of professionals who work in the public health sector in ports and airports. And we did that to improve preparedness. So other IHR responsibilities, we try also to merge with our port and airport expertise to strengthen collaboration within and outside the network. And we educate, train, and practice not only for the ship sanitation, but we include as much as we can ship sanitation in this program to make our group of public health experts we have in the country into one network that shares expertise, not only the ship sanitation, but anyone who has to do with points of entry in practice. In this way, I also try to make sure that our goal, the main goals of the IHR in this topic, like to stop the spread of infectious disease, that this is a focus we keep in sight, and we also communicate with other professionals than the inspectors and work together. Well, SSC registration and communication, we use the European system that's made available by ShipSan. So this is only available in Europe, the EU Common Ship Sanitation Database. It's used by 15 European countries, and it's built by University of Thessaloniki, Greece. The ones who use it are very familiar with it. But unfortunately, it's outside of Europe. I don't think it's available. And there we can register ships, we can register shipping companies, and also the port or public health authority and inspectors. And we can issue all certificates, exemption, extension, and control, including the evidence report forms. We have an additional program in Europe, the European Inspection Program for Passenger Ships. It's an addition, it's not IHR, but is solely dedicated for passenger ships with their specific risks and the large number of people they are carrying on board. And this can also be done in the same system. When it's about communication, also this system we try to use as much as we can for public health events. But more recently, it was updated with a port-to-port communication system, which is not used extensively, but we try to support as much as we can the use of this system, because we also think communication between ports, between inspectors within the country, but also internationally, is very important for making uniform these inspections. The uniformity is, as I have repeated, is difficult, but it's very important that when something is odd, when something is different, should be discussed, that you discuss it with international and national colleagues. This is a way to find out how other countries and inspectors approach the task, and it can give insights that you would not get when you carry out the inspection on your own or just discuss with your colleagues. So the SSC registration and communication, we use this system, but in generally what I'd like to say is that this is something we think is important, and there's need for improvement in this phase. This was my presentation. I thank you for the opportunity, and if there's any questions, I believe I will hear those.
Thank you very much, Thijs, for that very interesting presentation tonight. And with that, now I would like to hand over the floor to Sarah for more participation from the attendees. We have a poll and some Q&As. Over to you, Sarah.
Thank you very much, Priya. Apologies for the audio. So we have been monitoring the chat, the Q&A, the questions and answers. Thank you so much for all the very active participation that we are seeing. First of all, I would like to mention that I can see some hands up in the attendees. Please remember that we are addressing the questions and answers in the question and answer chat. So please feel free to write your questions. We are responding to them in written as much as possible, and then we will select a few whenever time allows for the discussion. We want to respect also the breaks for everyone. We know that online webinars are not easy to follow for such long, so we also want to give the due dates, the due breaks. Now let me answer some questions that here live that we have received that I believe will be of interest for many. First of all, participation certificates. So we are going to send certificates of attendance to all the attendees of this webinar after the 2-day webinar and after completion of an end of webinar questionnaire that you are going to receive in your emails. After that, you will receive your certificate of attendance. Regarding the videos and also the presentations, all of the materials are going to become available on the WHO website as well. We have received also a key question with regards to the latest text of the IHR, the amended IHR that entered into force in September of last year. And we have included in the Q&A the link to the amended IHR text, as well as the link to the IHR list of authorized ports. However, remember that the presentations will be made available to you, so you will also be able to access them there. Now, if I can pick one question from the ones that we have seen in the chats, and this will be for the colleagues in the Netherlands, we have Mr. Thijs Wenstra that has presented, and also I would like to mention that we have Ms. Tanya Hartog, that many of you may be seeing responding to some of the questions and answers in the chat. She's a specialist on infection control and a ship inspector from the Municipal Health Service Kennemerland in the Netherlands. So both of them are available to respond these questions. Now, the question is with regards to the charges to conduct ship inspections and to issue ship sanitation certificates. We know that different countries approach this issue differently, and it's a question that we often receive at WHO, so this is a very good opportunity to have that discussion. Colleagues from Netherlands, are you able to share with us a bit of information as to how you go about charges? Thank you.
I was wondering if my colleague Tanya is there, because I'm not aware of the exact amount, but there is an hourly charge. So the length of the inspection depends or is important for the charge. Inspections often take long. We include the travel time. So for these inspectors, well, $300 to $400, I think, if you would pay in dollars, or 400 euros would be a fee. And we are aware that there is a lot of change, and some countries around us do not even charge. So we feel it might be quite expensive, but to us, it is generally the cost we need to cover the inspector.
Thank you very much, Thijs. I just want to see, give you just a minute to see. Yeah, Tanya, I can see that you unmuted yourself. Please go ahead. It looks like
now
we can hear you. Go ahead.
Sorry about that. Yes, it is just as Thijs told you. And we know that in some countries the charge may be lower, but we also find that a lot of ship companies prefer getting the certificate in the Netherlands because the quality of the inspections is quite high. and they can be sure that we will not ask ridiculous measures, and we will not charge any fee or any fines for shortcomings. So, and it's different. It can be different around the world.
Thank you, Tanya. Indeed, different countries approach the issue of charging differently, and we're going to have other country case studies today and also tomorrow, so we will be able to hear also from other facilitators. Now, before we break, we have 1 minute left, so we would like to launch one more poll question related to the presentations that we have covered in the session so far. So you may see the question on the slide. We're giving you again 30 seconds to answer the right answer, hopefully. And then we will reveal the correct answer. Fantastic. So we have over 200 answers so far. We will reveal the correct question, please. And we have a majority, 67%, that have answered the correct answer. States parties can update the information directly themselves on the IHR list, and they can contact the WHO Secretariat at IHR PAG, IHR PAG at who.int if they require support. So as Dr. Wang mentioned, we hope that that percentage is going to increase over the course of today and tomorrow. So colleagues, we want to respect the agenda of this webinar. So we are now going to go into a break. We know online meetings are difficult sometimes to follow on the screen. So we're going to have a 15-minute break, and then we will come back and enter more in depth into the technical topics with the support of our facilitators. Thank you very much to everyone. See you soon.
Oh, I hope everyone has had a good break. Welcome back to the next hour of this 3-hour special EPI-WIN webinar. In the morning, you had an overview of the processes, the legal framework, you had practical country experiences. Now, we would like to start the next hour by inviting Dr. Martin Walker, Independent Points of Entry Specialist and Port Health Officer for the London Port Health Authority, to talk about pre-inspection planning, equipment, and administration arrangements. I think Martin has had many, many years of experience in this, and we invite you, Martin, to share your experiences. Over to you.
Thank you, Dr. Spryer, and good morning, good afternoon, and good evening, everybody, as the case may be. Delighted to be presenting to such a global audience. As you can see, this is the start of the practical session, and in true form, I'm a practical person. You can see me broadcasting here from the cargo hold of a container ship, the base of it, but no, seriously, this is the background photograph, which I will actually refer to at various points within my presentation in relation to communication and other aspects. This was a ship that we actually dealt with through a control certificate where we had a rat infestation. So without further ado, I'd like to move on to my presentation. I will just set up to share the screen with you all now. And I hope if I can just set that to the slideshow, if somebody could confirm that you're seeing that all okay.
Yep.
A couple of thumbs up. Lovely. Thank you. So pre-inspection planning, it's really one of the key parts of your inspection. We all know or probably have experience of just how intensive these inspections are, how resource heavy they can be, what's involved. You'll probably have had a feel for that from some of the other presentations, particularly in relation to the knowledge required, etc. So in this short session, I hope to give you some tips and some other ideas for how you might be able to better prepare and be able to make these inspections, or the pre-inspection part leading on to the inspection, that bit more efficient. And people who know me, people who've attended any of my presentations in the past will be familiar with the fact that I always advocate the use of the WHO Technical Handbook, which is shown there on the screen, that I'm sure has also been referred to many times before. We do often focus a lot on the technical standards that are contained within there, but for this presentation, we are focusing much more on the preparation side and the administrative arrangements, which you'll find within the narrative within about the first 30 or 40 pages of the document. And it really is very useful and essential reading. It's divided into various sections, and it can help you prepare for both the requests that come in, but also planning for that onboard inspection. Within the various sections, you'll have already heard some of the examples around communication and how important it is between states parties and between WHO as the overall overseer of the international health regulations. But there are many other communications that you need to make sure that you have, and you have the systems in place in order to carry out an effective ship sanitation inspection, and also provide that ship sanitation service to those that are requesting it. So the typical types of stakeholders that you may be dealing with can be ships operators, or more likely perhaps their agents rather than the operators themselves. Other government authorities, the port authority itself that may need to grant you access for security purposes, customs that typically will also have roles in relation to vessel boardings as well, police and other on port agencies that might, depending upon your national arrangements, have interest in the vessel arrival. I think we've already heard mention of communication systems between ports of calls. That is probably one of the areas that is rather difficult. There is the option to add your port details within the IHR authorized list, and that can certainly help. Otherwise, it's our good friend Google or other search engines that may exist may be able to give you a contact with a port health authority in another country, or through the national states parties. But either way, unfortunately, previous and next ports of calls communication can be difficult. It is important though, and the example that I referred to in my background photograph, where we had the rat infestation on board, after issuing the control certificate, we certainly made every effort to notify the next ports of call that vessel was calling in at, so that further assessment could be carried out. So I think probably Thijs in the Netherlands and so my colleagues in Hamburg will have, through the various agencies, will have received that notification at the time. We may also need to make sure, depending upon the setup within your own countries, how you have communication between local and possibly national health authorities, possibly your that might be your IHR national focal point, that is your national health authority, but you may be operating on the local authority level. However it's set up, and there is no one size fits all model, having those communication systems in place and knowing who is responsible for what are going to be critical in order to make sure you have an effective system in place. Equally, you may need to consider procedures for notification, any assessment response that might be necessary for public health events that may arise. You may well receive those directly through maritime declarations of health, or by other media or other notification means, possibly social media, possibly complaints, etc. But however you receive them, having procedures in place for those are going to be important. We've already heard about the authorized ports lists, and a common theme, and I hope that I will not be guilty of this during my 20 minutes, we need to ensure that inspectors are capable of clear communication. I hope that my communication will be clear during these 20 minutes. A big area that the handbook teaches us and sets out where we need to make sure as an inspecting authority we have considered and dealt with the matter is with regard to training. We talk about identifying competency criterias that may be either at the national level or local level. Qualifications, these are likely to vary substantially between countries, and there is no one particular type of qualification that is absolutely essential for these ship inspections. They are very much dependent upon the national setup. But training needs for inspectors are always going to be a key, and it's probably significant that we have so many people on this webinar today that we've struck a chord, that there is that need, there is that requirement for training to be built upon, and we hope that this will just be the start of a journey. So some of the things that the inspectors need to be aware of, we've hopefully given you a little introduction to the legal framework of IHR today. Different types of ship sanitation certificates, the difference between control, exemption and extensions, the checklists within the handbook, any necessary procedures that you have locally to inspect ships, as well as in accordance with the WHO Technical Handbook. The Technical Handbook also gives you an example of a likely flow of inspection according to the size type of the ship, but planning is going to be necessary depending upon the type of vessel. Particularly a larger cruise ship is going to require a different approach, perhaps to a small cargo ship with only perhaps 10 crew on board. And also training in relation to issuing certificates, how to complete them, including in English, though French is also the other accepted national language that can be used. So SSCs can be in either English or French. In any other language, unfortunately, they do have to be translated either into English or French. Administration, the need to make sure that you have your record management on there. That might be the need for a national requirement in terms of auditing for reporting purposes to WHO on their annual SPA reporting system that's there. It's also necessary for your own in-house use as well. Other matters that might be considered could be quality management schemes. The systems collect agreed fees, and IHR does mandate that the cost of this inspection should be covered by the conveyance operators. And also making sure you've got capacities to implement or supervise any control measures or any other measures that are required to be undertaken by the ship as a result of your inspection. Finally, other things that are sometimes overlooked, identifying access to ports, areas for safe inspection, any companies that might be able to provide assistance or services to deal and provide control measures on board. I'm not going to dwell too much on equipment. This is set out in the technical handbook, and my understanding is that you will get copies of these slides afterwards. This is just a snapshot of part of the tables within the technical handbook that gives some indications of equipment that you can use. It's by no means an exhaustive list, and you may find that other pieces of equipment or other items are necessary for the course of your routine ship sanitation inspections. Some examples that of typical equipment, though, that is often taken on board, and I would stress that these are for normal inspections. What you take on board is likely to be extremely different for outbreaks and what will be necessary to deal safely with any outbreak on board. But you can see some examples there. The only thing I would just highlight, there's reference there to chlorine kits, chlorine and pH measurements that you could take for onboard water sampling. The only thing that I would always say is make sure you understand the system that's in place for disinfection before you do a test, because that vessel may not necessarily be using chlorine. So if they're using any other form of disinfection, your chlorine kit is not really going to give you any useful information other than a very low or zero reading that is going to be a false problem. WHO is also very keen to stress the need for personal protective equipment. We do not expect inspectors to be putting themselves at any sort of risk, particularly in relation to routine inspection. You will need to follow your own national or local employers' guidelines or requirements in relation to the inspection personal protective equipment that you carry on board, but these are some general examples of some of the standard pieces of equipment that you're likely to use. Again, they are not exhaustive. Other equipment and documents, besides the must-have handbook that you must take on board, Otherwise, I challenge anybody to effectively carry out a ship sanitation inspection without that handbook. It really is the font of all knowledge when it comes to ship inspections. For most, probably virtually 99% of what you'll come across. Need to have your model forms available if you're going to be issuing them on the ship. The technical handbook also gives the template examples of stamps that you'll need for attachments, such as adding the evidence report form. If you need to stamp the certificate to extend the SSC by another month, templates are within the handbook there, and you can also see snapshots within the slide there. Other things listed on there, hopefully they are self-explanatory. Before you go on board, any requests that you can carry out that are necessary for ship inspections to help you determine your inspection plan, your inspection approach, how long you're going to be able to spend on board, etc. There's some information there about typical piece of information that could be provided by the ship's agents. I would also add to that any documents that you can get in advance from the vessel that you might otherwise look at for as part of your documentary check is going to help you be more efficient on board in terms of you will have seen those documents in advance. You could also write them in advance onto the ship sanitation certificate. But it's also potentially going to give you additional information as to where you might want to plan greater time to inspect and where you might have questions arising. So anything you can get in relation to documents in advance, I would always highly recommend. The eagle-eyed amongst you there may have spotted that that's a maritime declaration of health form there. We are going to have to get used to the fact that that title is changing. The 4th edition of the IHR now refers to ship declarations of health, but I suspect that will be a little while before there's practical change over there. Again, some suggestions in relation to planning for on-site onboard inspection, checking of perhaps previous ports of call, vaccination certificates, any areas that have been visited by the port. So an affected area is an area that's been declared by WHO under, I think it's annex, one of the annexes in IHR, and it's all to do with the necessary controls for vector infestations on board, or affected areas that are endemic with particular vectors. For practical purposes, I think I can tell you that at the moment there is no area within the world that has been declared by WHO. So whilst it's a theoretical matter under IHR, at the moment no area has been declared by WHO as affected under IHR. So you don't need to worry about that too much. It is a question we often get asked though. And obviously, if you've got more than just a routine inspection, if you've got infected people on board, you're going to have to do a completely different approach to your inspection as you would compared to how you would do for a routine renewal of a ship sanitation certificate. I'm conscious of time and being respectful to my colleagues, so I'm just going to zip through in my remaining couple of minutes for some other pointers. Anything you can do in terms of pre-planning will assist. If you are fortunate enough to have more than one inspector available to go on board, that's ideal. You can set an inspection team, give different assignments to different colleagues depending perhaps upon their strengths and skills, etc. But you will need to make sure that one person takes overall charge and will be responsible overall for making the final decisions. There are other suggestions on there for considerations prior to boarding, and hopefully that they're relatively familiar to most of you attending here. We also advocate before you go on board or whilst you're on board and having an opening meeting with the ship's master or captain, that you clearly explain the purpose of the inspection. Most likely for renewal of the ship sanitation certificate, they will be perfectly well aware of why you're there. But if not, if it's an unannounced boarding or you're attending as a result of complaints or suspicion of infections on board, then you're going to be needing to be clear as to the purpose of your inspection, because it's necessary that they can be able to act appropriately, furnish you with the correct information and resources required on board, such as accompanying crew, in order to make sure that you can carry out your duties efficiently and safely. Another matter that we do advocate strongly is that when you go on board a ship for a routine inspection, you're not just carrying out the inspection on board. Look at the operations that are being carried out on the quayside, perhaps before you go on board. So some suggestions there around typical operations that might be undertaken by the vessel when they call into the port. And the final slide that I have, just to reiterate about the onboard ship, the opening meeting that you have with the master. Hopefully you'll have already carried out your introduction. They'll be clear about the objective of your particular inspection that you're carrying out. But also it gives them an opportunity to give information back, so perhaps about operating conditions on board, whether there's any change to departures, so that you don't suddenly find yourself heading towards another country. Any safety rules that may need to be followed on board, and particularly making sure that you're accompanied at all times, because it is very easy to get lost on board some of these vessels if you're not familiar with them. Conscious of time, spot on the 20 minutes. I would like to say thank you, and I wish you a very productive and useful webinar.
Thank you very much, Martin. That was extremely interesting, and thank you for being right on time. So now we're on schedule. So I would now like to hand over to Sarah for the book. Apologies, no, my mistake. I'd like to actually now give the floor to Barbara for risk assessment and control measures for different vessel types. Barbara is Professor of Hygiene and Epidemiology and Director of the Laboratory for Hygiene and Epidemiology at the University of Thessaly in Greece. And the floor is yours, Barbara.
Thank you very much. I'm delighted to participate in this webinar. My presentation is about the different risks we have depending on the types of ships. I hope that you can see the first slide in presentation mode, and also that you can hear me well. So why it's important to be familiar with different types of ships and the different risks that you may face during a ship inspection. Of course, we all understand that every ship has different hazards, and by knowing the type of ship and be familiar with these types of hazards, inspectors can be better prepared, protect themselves, and focus on the areas that present the highest risk. And of course, since inspection time is always limited, risk assessment allows inspectors to prioritize effectively, allocate their time wisely, and ensure that critical safety issues are not overlooked. On this slide, you can see the three main parts of my presentation. We will start with common health risks on all ships, then review the different types of ships, and finally discuss the specific public health risks linked to each type. This will help us better target our risk assessment and decide on any potential control measures during the ship sanitation inspections. By the end of the session, you should be able to recognize common health risks on all ships, understand the main types of ships, and identify the specific sanitation risks that may vary depending on the ship type. We know that historically, ships were central to the spread of major diseases such as plague and cholera, and their critical role that they played in the spread of pandemics historically. While nowadays, air travel drives most rapid human transmission worldwide, ships still contribute to important public health risks in different ways. And these include onboard sanitation failures related to food, safety, drinking water, waste management, as well as outbreak occurring in closed settings among crew and passengers, and especially diseases that can spread from person to person. Ships can also support the international transport of vectors such as mosquitoes or even rodents, and even the movement of contaminated goods or environments. For these reasons, effective ship sanitation inspections remain essential for preventing the spread of disease and protecting global health. Ships are high-risk settings because they combine close living conditions, share food and water systems, and frequent international travel. They can transport infected people, vectors, and even contaminated ballast water or carry hazardous goods. Limited access to health services at sea makes response more difficult, so inspections remain critical for preventing international spread, but also protecting the population that works or is transported through the maritime transport. Having considered the different types of ships can guide the entire inspection. It helps anticipate health risks, decide which facilities to focus during the inspection, prepare the right equipment, apply appropriate safety precautions, and estimate the time required. And of course, all this can support a risk-based and efficient ship sanitation inspection. And now that we have discussed why ship type matters for risk assessment, we can briefly review the main categories of ships that inspectors may encounter during a ship sanitation inspection. In general, we can group vessels into several broad categories. First, we have cargo ships, which include general cargo vessels, bulk carriers, container ships, and oil tankers. These ships mainly transport goods, and inspection priorities often focus on crew accommodation, potable water systems, waste management, and any risks linked to cargo operations. Second, we have passenger ships, where the presence of a large number of passengers increases the importance of food safety, hygiene, recreational water systems, and outbreak prevention in shared spaces, especially for infections that are transmitted from person to person. We also have ro-ro ferries that combine passenger transport and also vehicles, and they have frequent port-to-port movement, creating specific operational and sanitation challenges. Another important category is fishing vessels, which may have unique occupational health risks, food handling concerns, and sometimes limited sanitation infrastructure. And finally, we have other types of ships like special purposes vessels, expedition vessels, training vessels, and others. And in the next slides, we will explore how each type of ship may present specific public health risks and inspection priorities. And we start with the general cargo ships. These ships may carry mixed goods such as pallets, boxes, barrels. And a key health risk include vectors like rodents and mosquitoes, cross-contamination between cargoes, and the possible transportation of hazardous materials. These vessels often have small crews and may spend long periods at sea without medical support, making preventive sanitation measures essential. We continue with the bulk carriers. One major concern here is the specific risks with the specific types of cargo that they carry, and specifically for oxygen depleted or toxic atmosphere inside the cargo holds. For example, cargoes such as grain, oil, or wood chips can reduce oxygen levels, and fumigation gases may also be present. For this reason, unplanned entry into cargo space is extremely dangerous, as these areas are confined spaces and require proper ventilation and gas monitoring. Bulk carriers also often travel on long voyages with small crews, usually without a doctor on board, so access to medical care may be limited. Therefore, inspectors should also check that medicines, medical equipment are sufficient to support crew health during extended periods at sea. So it's very important that inspectors are not entering cargo holds, and if this is required, this must be done only by trained staff, and including specific procedures such as atmospheric testing for oxygen, toxic gases, proper ventilation, and specific equipment. So this requires specific procedures. We continue now with container ships, and this involves important safety and health risks. Heavy cargo operations create a risk for serious injury for crew and also for port workers. So safety precautions during inspections are essential. Another concern is possible leakage or spillage from containers that carry dangerous goods, such as chemicals. And inspectors should remain alert to cargo-related hazards and potential public health risks. If during the inspection leakages are identified, then inspectors should keep a safe distance, verify from the cargo manifest and dangerous goods documentation of the ship, what is carried, and ensure that emergency response procedures are in place, including proper containment, ventilation, and use of appropriate personal protective equipment. Oil tankers, the main concern here is safety. Fire prevention is especially critical. Inspectors should also be aware of oily surfaces that increase the risk of slipping and accidents. Compared with other types of ships, the risk of disease vectors is usually lower, but basic sanitation checks and, of course, a proper inspection in the crew accommodation areas is important. We continue with passenger ships. The inspections of passenger ships present unique challenges, especially due to the size of the ships and the large number of people that are transported on board. This means, of course, that many people on board, passengers and crew, are exposed to the same sources they consume, food from the same source, water, they drink water from the same source. And of course, they live in confined spaces, semi-closed environments, and person-to-person transmission of disease is very likely. Passenger ships often have medical facilities, depending on the size and the number of people that are transported on board. And they have also surveillance systems, so this can be also considered during the inspection. But still, inspections remain complex because there are many areas to check: restaurants, bars, recreational water facilities, childcare spaces, and others. Fishing vessels have specific occupational health risks, as we mentioned before. Crew often work long hours and are exposed to weather conditions, which can increase the likelihood and severity of work-related illnesses. Injuries are also common. And that's why it's important to make sure that a proper equipment is on board and to ensure that infected persons or persons with wounds, that there are the specific equipment and knowledge on board to deal with such events. And because fishing vessels may operate far from shore for extended periods, it is important that medicines and equipment, as we said, is available and is sufficient in number to support the health of crew members. Now we can have other types of ships, like naval ships, used for military purposes, yachts, and others. Although these ships may have different functions, the same principles for ship sanitation inspection applies. And we should not forget that a ship sanitation certificate should be available on any ship on international voyage, independently on the size of the ship and independently on the operation of the ship. Now, as a key messages, we can say that ships with small crews on long voyages face particular health risks because medical support is limited and access to care may be delayed until the next port. Fatigue, stress, and shortages of medicine or hygiene supplies can quickly affect crew well-being. Therefore, inspectors should pay special attention to medical stores, sanitation conditions, and preventive measures to protect health during extended periods at sea. Of course, the type of ship is a key factor in inspection planning because it determines the main health risks, facilities to inspect, and safety precautions that are needed. Thank you very much for your attention. I hope I was on time and respecting the agenda.
Thank you very much, Dr. Barbara. That was bang on time. Really appreciate that. And a great presentation with some very pertinent key messages to recall. Now,
it's time for another pop quiz to see if you have been listening carefully to Barbara's presentation. We will give about 30 seconds for the participants to answer. Wow, we're already at almost 200 responses. That's very quick. We'll give everyone 10 more seconds. Okay, we have about 60% of the participants who have responded. I will end the poll now and hand it over to Barbara to reveal the correct answer.
Well, it's very nice to see that the 87% have answered B, bulk carrier. Excellent. And why is this? Because, as we said during the presentation, bulk carriers may carry specific cargoes like grain or coal that use up oxygen and create very dangerous conditions inside the cargo holds. That's why inspectors should not enter such spaces unless if they are trained, have the personal protective equipment and having also the specific SOPs that are needed for this, measuring the oxygen, etc. So usually an inspection does not cover access to cargo holds. So thank you very much.
Thank you so much, Dr. Professor Barbara. And with that, I would now like to hand the floor over to Dr. Yahya Alamis from the General Directorate of Health for Borders and Coasts of Turkey to talk about the issuance of a ship sanitation certificate and evidence report forms. The floor is yours, Dr. Yahya.
Thank you, all the colleagues, dear colleagues and participants. I greet all of you with respect. I present the issues of the ship sanitation certificates, but in the chat I saw a lot of questions asked about the ship sanitation certificates. It's not possible to reply all of the questions by writing in the chat box. I have taken some notes about your questions, and I will try to reply these questions in my presentation. Let's start with the beginning. Yes, we had two presentation about the ship sanitation certificates and the authorized ports. So we have some idea about these certificates. In this presentation, I will talk about the WHO handbook, different type of ship sanitation certificates, how we complete ship sanitation certificates and evidence report form, and the meaning of the extension of the certificate. According to IHR Article 39 and Annex 3, yes, ship sanitation certificates should be issued according to these articles and these annex. There was a questions about is there any format for the SSC? Yes, there is a format. IHR Annex 3 provide us a format for the ship sanitation certificates. It is a inspection of ships and the issue ship sanitation certificate. It's a global, let's say, communication method between ports. I saw the ship sanitation. I see the ship sanitation certificates a kind of letter from one port to another port, or from one country to another country. In this SSC method, we can communicate among ports and we have a communication about the public health risks on board ships and the control measures. So, according to IHR, all ships in international voyage must have a valid ship sanitation certificates. So it means that ships must have ship sanitation certificates. But on the other side, asking a valid ship sanitation certificates for the ports and for the country, depending on the country implementation. A country may ask every time a valid certificate from every ships, but maybe the other country asks ship sanitation certificates during the pandemic time, or if a ship has a problem for public health, then they can check the ship sanitation certificates. So it is a obligation for the ship, but it's the right to state party to ask and control the ship sanitation certificates. Yes, ship sanitation certificates valid for 6 months, and it may be extended 1 month. We will see in the next slide. This is the model ship sanitation certificates of the IHR and Annex 2. It is 2 page of paper. 1 page is the main certificate, control or exemption. The other one is the attachment to the ship sanitation certificates. And it is strongly advised that all the countries use such kind of model for the ship issuing ship sanitation certificates to have a uniform implementation in global level. We have a technical guidance. It was issued by the WHO. I strongly recommend that all of the port health, public health or port health officers or ports should have this guidance handbook and use it in their inspections and issuing of the ship sanitation certificates. This because this certificate has a common checklist to inspect the all parts of the all areas of the ships, because there are a lot of areas in the ships. For example, food safety, water safety, waste management, pest management, and other medical room. So this checklist is a useful tool for all of the ports to inspect that kind of all kind of ships, and they use some standards. In this checklist, you can see we use codes, and we use the evidence and the corrective actions, and there is some comments on the. It is a recommendation. This article, it's a recommendation or required. Recommendation means it's a scientific advice or should be followed because it's the best practice. But if it is a required, it means that it is a requirement of an international convention. So it shall be followed by the ships. And there is a 3 scenario we can issue ship sanitation certificates. One is clear. A ship can ask a new certificate. It's easy. But the second option is we make a re-inspection for the ships because maybe we have some complaint or we want to make an unannounced inspection. So we can inspect the ships if a ship has a valid ship sanitation certificates. So after the re-inspection, a new ship sanitation certificates can be issued. Another issue is if a ship has a public health emergency or public health case in the onboard ships. So then we have 3 basic scenarios to issue ship sanitation certificates. And as Mrs. Niglan mentioned, we have two basic type of ship sanitation certificates. One is exemption certificates, the other one is control certificate. What is the meaning of these certificates? When we go to the ships and make inspection, if we do not have any evidence of public health risk, so the ship is good have a good condition, there is no public health risk, so we issue ship sanitation control exemption certificate. It means that this ship is a good, and the other ports do not need to control or inspect this ship again. We make this exemption when we issue this certificate, and the other ports understand that this ship is a good have a good condition, and then we don't need to inspect this ship again and again. Another one is the control certificate. It means that we we see some public health risks or evidence of public health risk. So we ask the other ports to make a control for that ships. For that reason, we issue control certificate. The second option is if we implement a kind of control measures. For example, there is a vector infestation in that ship, and then we ask them to make a disinfection. But you know, disinfection, just one disinfection is not enough for the for solve this kind of problem. Maybe in the other ports, they need to control if our control measures is a good provide a good condition to ship or not. So in two options, we need to issue control certificate. One is if we can find evidence of public health risk on board ships, and the other one is if we implement any control measures in our ports. Most of the ports or most of the colleagues do not use the second options. They issue exemption certificate after they implement control measures. No, according to WHO guide and our implementation, in this case, port health officer must issue a control certificate, because the other ports has right to know the situation of that kind of ship. Let's sum the basic rules again. If there is evidence of public health risk, please issue exemption certificate. If you find evidence of public health risk, or if you implement a control measures, please issue a control certificate. Then the other ports control this ship or inspect this ship again to follow up your findings or your measures. You can see an example of the ship sanitation control certificate. If we issue ship sanitation control certificate, we should use both sides of the certificates. There is two tables on the certificate. On the right side, in the left side, if we use the exemption certificate, we use the left side, left table. But if we issue control certificate, we need to fill both tables, two tables, left and right. And you can see the second page of the ship sanitation control certificate. So how can we complete the ship sanitation certificate? It is important because, as mentioned before, it is your letter to send all of the other countries from your ports. So it represents your ports and you. this is your letter. So because for that reason, please be careful about the completion of your ship sanitation certificate. Be careful. Use the right terms and use the right wording. Ship sanitation certificates must be issued after a complaint inspection of ships. But if we don't have a chance to make a full inspection, so we can issue again a ship sanitation certificate, but we can use some words. For example, we can say that partially inspected. We can in all the time we don't have a chance to inspect for cargo holds or some other areas. Maybe some of the doors are closed, and we don't have any chance to inspect. So we can use the partially inspected in our inspection. After inspection, we use these words in the ship sanitation certificates. So you can use some specific terms and the wording from the handbook. Please use the WHO handbook. It's a useful tool. There is some question about the language. Yes, at least one language should be English. You can use other language together with the English. And you should sign and stamp your certificate. Let's see some specific terms we used in the ship sanitation certificates. If there is no area in some ships, for example, in cargo ships, we don't have pools, so we can use not applicable in the certificates. If we inspect partially, we can use partially inspected. If we found a public health risks on board ships, we should use yes, see attachment. We use attachment. If we don't have any evidence of public health risk, we use mostly none or nil. It means that there is no problem. There is another question about the samples. Maybe we take samples, but we don't have the results of the sample. Yes, we can issue ship sanitation certificate, and we use the words sample results pending. Yes, we have a evidence report form. Evidence report form is an attachment for the certificates because the certificate is a two paper, and then we don't have enough time, enough space to write all the things in the handbook. There are a lot of articles, so we can use this evidence report form for when in two times when we issuing a new certificates, or after some times, after some months. I mentioned that we can make a re-inspection. For example, some colleagues issue exemption certificate, but after 4 hours, the health situation of the ship has changed. So you can use evidence report form and attach the certificate and send another message to the other post that yes, there is a exemption certificate, sorry, but there is some other problems on board ships, and please follow up these problems. I replied to another questions. We can use evidence support forms in the beginning, but we can use it after some time. How can we complete evidence report form? So we should use WHO handbook articles codes. It is easy because these codes include both evidence and both control measures. So in that way, you can see on those slides, we can use many more articles on the evidence report forms. But on the right column must be empty for the re-inspection. If we put some articles, maybe after ship goes to another country, the other colleagues in the ports make another inspection and check this ship again. You can see some examples of the evidence report form. I put some evidence, two evidence report form. One is from Mr. Walker and one is from me. You can see the examples. And extension. In some scenario, ship can ask the renew or new ship sanitation certificate, but for some reasons, we don't have any chance to issue ship sanitation certificate because maybe there is a public holiday, or we don't have enough inspectors, or at the same time 5 ships ask the ship sanitation certificate. So we don't have any chance to issue ship sanitation certificate, but we don't have any information about the public health risk on board. So we can issue, as a port health officer, we can issue an extension, 1 month extension for the ship sanitation certificate. This is the exceptional case. We give another time, another 1 month to ships to have a new ship sanitation certificates. In the real situation, yes, there is a IHR article and the WHO handbook, but in the real life, we have a lot of different different scenarios of different events about the ship sanitation certificates. Most of the time, we see the unauthorized ports issue ship sanitation certificates. The other countries may not accept this kind of certificates and consider this ship as effective conveyances. And different model of the ship sanitation certificate we saw. There are a lot of problems about the ship sanitation certificates. I don't have more time. And for that reason, I am stopping at that moment, and I am checking the questions. I am trying to reply most of the questions. One is maybe military ships or yachts. It depends on the countries. Maybe some countries ask ship sanitation certificates from the military ships or yachts, or during the pandemic or epidemic times. It depends on the countries. And thank you for your attention. This is the end of my presentation.
Thank you so much, Dr. Yahya, for explaining the ship certification process. And now, to explain the practical application, I'd like to invite Dr. Leila Bouziani, Health Officer, Tangier Med Port, Morocco. The floor is yours.
Thank you so much. Hello. It's a great pleasure to be part of this webinar for issuance of ship sanitation certificate, the SAC. As you know, that the vessels are a strategic point of passage and international trade and passenger transport, and they represent for sure potential vectors for communicable diseases and global health risks. For this, the issuance of ship sanitation certificates have a very important role according to the HR for protecting the public health and prevent the international spread of diseases. Now, in the beginning, I will make small introduction for Morocco's country profile. Please, if you can move the slide. The next, please. Thank you. Kingdom of Morocco, located in the north of Africa with the 37 million populations and the 1,515 kilometers area surface. The Kingdom of Morocco, it's bordered by the Mediterranean Sea to the north and the Atlantic Ocean to the west. The official language, it's Arabic and Berber. French, it's considered like a second language, and Spanish also, it's spoken in the north of Morocco. It's considered among the top 20 touristic destination in the world. The next, please, next slide. Moroccan ports have two maritime facades, Mediterranean Sea and Atlantic Ocean, with 3,411 kilometers of coastline. And he has 14 ports distributed according to their typology as follows. 20 multi-purpose ports open to international trade, 21 fishing ports, and 6 marinas. And we have 20 designated ports according to the HR. I will show you this in the list in the next slide. Please, if you can, next, please. Okay, this is the authorized port in Morocco to issue the ship sanitation certificate. We have 2 ports can issue the ship sanitation control certificates, ship sanitation control exemption certificates, and the extension is Casablanca at Tangermed. And for the others, they can issue only the ship sanitation control exemption certificates and the extension. Now, after this introduction, I will move now to give you an overview of the ship inspection system and how to issue the ACC in Tangermed port. First, the department that he is able to issue the ACC, it's the Health Board Control Service in maritime entry ports, and he is under the Ministry of Health and Social Protection. And all Moroccan ports that can issue the ACC, they are included in the HR list of authorized ports in the list of WHO. And the certificate is issued by Moroccan ports following the procedures defined in National Manual of Border Health Control Procedures for Moroccan entry ports as official and national reference. The issuance of ACC, next slide please. The issuance of ACC by Moroccan ports complies also with international regulation according with the requirements in Article 39, and we use the model provided in Annex 3 of the HR, and also all Moroccan ports now use the handbook for inspection and issuance of ACC. Next slide, please. Now this is presentation of Tangermed ports. It's considered like a global logistic gateway located on Strait of Gibraltar, and the port complex it's include Tangermed Wad comprise 2 containers. We have terminal. 2 terminals, containers, a railway terminal and oil terminal, general cargo terminal and vehicle terminal. We have also Tangermed 2 with the 2 containers terminal, and we have passenger terminal. The ports, it's connected to more than 1,020 ports worldwide and 17 countries in the 5 continents through several shipping companies. For capacity of the port, he make treatment of 11 million of containers, 300.22 million passengers. This including passenger transiting on the port during the Marhaba operation. This is special season for us for transit of passenger from Europe to Morocco, which represents exceptional summer peak in passenger traffic. And now, and for capacity of trucks, you can, the other slide, please. And for trucks traffic, the port, no, the other side, please. It's okay. Thank you. And the port can make treatment of 535 trucks traffic and approximately 1 million vehicles. And for Tangermed, it's considered like, not like, but is authorized and designated ports, and has, next slide please, and has both routing capacities according to the HR Annex 1A for surveillance and response, and the port has also the emergency response capacities according to the HR Annex 1B, with, of course, permanent for monitoring and control and also management of events that may constitute a public health emergency of international concern. To deal with this emergency in the ports, we have a public health emergency plan, which is updated annually based on epidemiologic data, lessons learned for sure from after action review of public health emergency risk that we have in the ports. And it's based also for assessment and analysis of risk, and if we have some extension area in the ports. Next, please. Okay, now I will share with you some of capacities of our port to issue the ACC. Are follows. We have a regulatory framework, ACC issuance procedure, also communication procedure, electronic register for issuance ACC, and monitoring complaints for regular ships. We have a qualified and trained inspector officer. We have inspection equipment, logistic means, and for communications also inboard and ashore. And we have the easy access to the laboratory, and we do regularly training in our office. Now, for among capacities required by the border health control in Tangermed, we have vector control and surveillance on board ships and also on the shore. In this field, we have the vector control plan. It's updated regularly. We have monitoring, entomological surveillance, and we take sometimes, if it is necessary, specimen sample, and we send regularly to the National Reference Laboratory for confirmation. Another requirement capacity, it's the inspection of the engineer room. Next slide, please. It's the inspection of engineer room. This area was before difficult to make inspection, and now with the training we have a new knowledge acquired for this area to be inspected. For next step, please. Next. This slide, it highlights several best practice implemented by Border Health Control Service to ensure the traceability of actions like database register for ACC, also followed by regular ships after the exchange of ACC for the ships that we send, that we make for him recommendations or prescriptions. Also, we share and we discuss in our office with the team the complex cases, and we develop internal procedure for each past critical case. And also, we coordinate usually with the masters to obtain response and corrective action regarding recommendations issued by the Border Health Control. And this correction, they are sent after or communicated after by master email. And as you can see in the photos, here is a simple example of vessel that has addressed these recommendations along of others and submitted the response by email. The next step, please. Thank you. The Border Health Control Tangermed has participated in several trainings with WHO to issue the ACC in the national and international. And now I will pass to share with you the procedure for issue the ACC. Next, please. This is a model of communication plan of ACC requests in Tangermed. all ships that they need to issue the ACC must advise or request the certificate 48 hours or more before arrival to the port authority and the agent shipping. Both of them, they send requests for the border health control. And after the border health control make planning and give schedule and time for inspection. After that, when the border health control start the inspection, according to the schedule provide, this planning, it's for us, for our department, he is a very important step because allows to maintain the organization of service actions as it's indicated by Walker in his presentation. And also he reduced the impact of the ship's operation and avoid disruption. This practice ensures an effective, safe according to international requirement. And after that, if we have some public health during the inspection, the border health control inform the agent, port authority, next port, and the national focal point. Sorry. Now let's go to the administration formalities before berthing and when the ship is berthing. Before berthing, we have some general rules for all the ships. They must submit documents before arrival. This is important step for us to make first evaluation and assessment, and then we authorize the ship to enter to the port with scheduling of the inspection time. And when the ship berthing, we give a standard border health control service for completed and designated, and signed by the ship's captain on board to validate the request before start inspection. After that, in the end of the inspection, a meeting with the team to note the anomalies and the prescription for different area, and then the team leader give the prescription to the master, and we start to prepare and issue the certificates. Next, please. This is the model using intangible according with WHO in Annex 3. Next. And for the evidence report, it's the same according to the WHO in the handbook. Next, please. This is a review for exchange of certificate like statistic between 20 and 2025. This exchange of ACC in Tangermed, it has increased from year to year. It's driven by highlight traffic and new shipping lines at the ports. Next, please. For challenges, we have, like all ports, allocation of time to prepare for inspection, usually insufficient, and especially for the ships that they have small time in the port. And also using of technology in the inspection of the area that are difficult to access. Absence of radioactivity control measures. Continuous training should be reinforced in accordance with the weakness identified. Thank you so much. If you have some questions, I'm still here.
Comprehensive. Thank you for that very comprehensive presentation. So today, with Dr. Leila's presentation, we've covered quite a lot. I now hand the floor over to Sarah, as usual, for the poll and for the final Q&A. Over to you, Sarah.
Thank you very much, and thank you everyone for the very active participation that we are having in this webinar. We have a very busy Q&A chat. Thank you so much for all the facilitators who are not only presenting, but also doing their best to answer all of the questions. It looks like we have a bit of time left for discussion. So I have selected a few questions that have come up, and then I will ask different facilitators, but I can also ask them. I see you here on the screen if you would like to answer. I think, Leila, you are unmuted, so maybe you want to mute your microphone. for now?
Yes, sorry.
No problem at all. So I will select a question, ask a facilitator, but please, if any other facilitator would like to come in, feel free to unmute yourself and I can see that in my screen. So the first one, we have a question for you, Ninglan, regarding the change in the terminology in the IHR as part of the amendments. There has been a change from maritime declaration of health to ship declaration of health. The question was, why is that change? Can we ask what's the rationale for that change?
Thank you. Thank you very much for that question. Indeed, that came up quite often in terms of why we have this one word change and to terminology changing. I think that was the discussion during the member states negotiation for the amendments of the international health regulations. If you see the certificate, the requirements, the contents, the text in the certificate itself is very much geared towards the risks related to the ship, where if we call it maritime health declaration, that provides a broader scope because that could relate to the port and the other maritime associated risks, which is much more broader than ship only. That's the primary reason of that amendment. I hope that answered. Thank you.
Very clear. Thank you, Ninglan. Okay, I see some hands up. I don't see any other facilitator unmuting, so I will go to my next question. I will ask Martin. I see you've been able to allocate some time to be here in the Q&A, so thank you so much for that. Maybe you can address this other question. We have received a few of them regarding the qualification of port health officers and ship inspectors, how these vary across countries, what are the most common qualifications in terms of academic background, of professional experience, but also a question with regards to whether there is any recommendation from panelists, and of course I will open this question to anyone that wants to add, regarding additional postgraduate qualifications that are recommended to these ship inspectors and port health officers. So over to you, Martin.
Okay, thank you, Sarah. I think overall it's the fundamental right of the state's party under IHR to decide exactly who is competent in order to carry out ship inspections and what their appropriate qualifications should be. So there are multiple different arrangements around the world from what I've come across. In the UK, it's typically environmental health officers that will carry out the inspections. And we have a broad public health training, but in other countries I'm aware that a lot of the times it's the medical professions that will carry out those inspections. It may be former ships engineers, it may be pest control professionals. There are multiple different ways. The other options could be using a multitude of different specialities to form an inspection team, but under an overall control of one designated person. So there is really a wide variety of different ways to do that. And I think IHR is deliberately open in that to allow for the fact that there are numerous different ways. What's most important to me is that people really understand what the purposes of the inspection are, they identify where the gaps are, and hopefully are able to fill them through training like this, the WHO e-learning, and also where possible face-to-face training. And I'll just say I look forward to coming to a port near you.
Thank you very much, Martin. Maybe I can also ask here Barbara Muchturi to come in if you would like to add anything regarding postgraduate qualifications that are recommended to ship inspectors and port health officers. And I bring here Barbara because her center is a WHO collaborating center on points of entry, and they're instrumental to the development of WHO guidance and training packages alongside many of the people that you see as panelists today. So over to you, Barbara, for some insights.
Thank you very much. Many member states, I can forward from our experience, many member states have required that all inspectors, before they start inspecting ships and issuing ship sanitation certificates, must complete the WHO online training.
Barbara, we are having, I'm very sorry to interrupt. We're having some problems with audio, and I think it may be affecting other participants as well. We cannot hear you very well. I don't know if you can get closer to the mic, or if there is a mic in your headset that should be moved.
You cannot hear me?
If you get closer to your computer, perhaps we can see you a bit, we can hear you a bit better. Now it's better.
Now?
Yes, now it's better. Thank you.
Okay. So thank you very much for this question. I can inform you that from our experience, many member states require from all inspectors before they start issuing ship sanitation certificates. So they have to complete the WHO training, the online training that is available in the WHO's site for issuing ship sanitation certificates. So this is one qualification that is essential, and this can be also be done as a refresher training in regular intervals. Now, we have seen from the member states that participated that another standard could be a certain number of inspections together with another experienced inspector before someone is starting inspecting ships for the issuance of ship sanitation certificates. There are also a variety of resources for training. For example, we have also a master degree maritime in public health and maritime transport at the University of Michigan. Considered as high education. The collaborating center. So far,
Barbara, we are experiencing, I'm very sorry that I need to cut you. We are experiencing some problems hearing you, but do not worry about it. I think I could capture a lot of your recommendations because that was a very rich intervention. So let me just summarize for the sake of the audience, because I think other people may be also having difficulties to hear you. So indeed, we could hear about the WHO online training. We've been sharing the link to it here in this webinar through the different chats. That's the global standard. We have also heard similar comments to those that the representative from the Netherlands was highlighting earlier today, things such as on-the-job training, of course, but also this idea of shadow programs, particularly when you have senior ship inspectors and port health officers that are retiring, and maybe you have the workforce renewing, and these shadow programs allow that knowledge and experience not to be lost. And then I also want to highlight, I could hear you, Barbara, speaking about the Masters of Maritime Health at the University of Thessaly as well. So thank you very much for highlighting all of those initiatives.
And finally, the WHO Collaborating Center face-to-face trainings that we have organized in the past and maybe in the future.
Fantastic. Now we could hear that perfectly. Thank you so much, Barbara. And again, thank you for all the support that you provide. If I may go next, we have another question that we received earlier today, and maybe I can see Yaya here on the screen. So one of our participants was asking about the all hazards approach when it comes to doing the ship inspection and the issuance of the certificate. They were commenting how we often see more of a focus on infectious diseases. What about the other hazards? Any reflections from you, Yaya, or from other facilitators?
Yes, the IHR basically and all WHO guides emphasize that not only communicable diseases, but also all kind of public health risks should be evaluated. Chemical risks, nuclear risks, and other kind of risks. I know that it is a bit difficult for the public health staff, because basically health staff inspect the ships for public health purposes, and issue the ship sanitation certificate, but they don't have enough maybe knowledge or background about the chemical hazards or the nuclear hazards and other hazards. The training is important. This kind of staff who issue the ship sanitation certificates should have such kind of trainings, and maybe they benefit from those guides. I know that in the European level, Barbara and some of those colleagues prepared chemical risks on board ships. There is some. I'm trying to say that there is some guides and source of knowledge. So this knowledge should be taken and should be evaluated in the onboard ships, because yes, chemical, ships carry a lot of dangerous goods. For that reason, we should evaluate the chemical risks and the other risks. Thank you.
Thank you very much. Thank you very much. Yeah. We have time for one last question from the participants, and then after we'll go into the poll question. But before that, let me highlight one more. So this is a question that we have received several times, not just in the context of this webinar, but also in others. And it's with regards to the application of the ship sanitation certificate for military ships. So I will hand over to Ninglan to address that question.
Thank you so much for this critical question. Indeed, it's very important, and depending on countries' arrangement, I just wanted to highlight perhaps some of our thoughts, and hopefully that can inspire your operation in the country level. And if you see the IHR definitions when it comes to the ships, so it really talking about the seagoing or inland navigation vessels on international voyage, right? So there are no exemption of any ship types and so on. However, we also understand from the IHR Article 57 require the regulation need to be read consistently with other international agreements, and knowing that the UN Convention on the Law of Sea that has basically a provision that the warships enjoy the immunity from the jurisdiction of any state other than the flag state. I think it's very clear how, regardless what type of ships, that public health risks will come and go. So we fully understand that this is important. If even the military ships, there are sort of a similar programs are in place. Having said that, we also understand that the country's realities may have very varied scenarios. What I wanted to hear, just to share these thoughts. First, practically speaking, if you see the IHR authorized port list submitted by the countries, they are all commercial ports, which is really accessible by the public. And the health matters, regardless of the types, for noting that regardless of the types of ships, the health requirements do fall within the scope of the IHR. And also realizing the reality, the military ships and the ports may be governed by the national defense protocols or other separate agreements. So we know that the civilian port health inspectors might not be able to have that condition to access, the warships and the military ships. So very practical approach, what we could suggest is really to engage the military, medical, and public health sectors, and to brief them on the IHR requirements, on this shipping inspection, and why we conduct this shipping inspection, and to explore the practical mechanism to ensure the hygiene and the sanitation standards on board. So basically, these inspections could be conducted by the military health service, let's say, and then through our jointly agreed mechanism, they can exchange the information and to make sure that any risks detected, even in the military ships, that can be detected and documented and handled in a timely manner. In terms of the certificate itself, it could be also discussed through this collaborative agreement or mechanism. So I think that's the way we suggest you can take it forward. Thank you.
Thank you very much, Ninglan. Colleagues, before we go into our final poll question, let me just give an opportunity for any facilitator, if I see anyone unmuting themselves that would like to complement. Okay, I don't see any. So, Sophia, over to you for the poll question.
Thanks, Sarah. So before Ninglan gives the closing remarks, we will have one final poll. It's on the issuance of SSC certificates. It's a longer question, so we'll give you a bit longer to answer. Okay, we're at about 70 responses. Okay, maybe just 10 more seconds before we end. Okay, I will stop now. We have 50% response rate, and I will give the floor to Yaya to give us the correct answer, please.
Yeah, you're unmuted. You're muted.
Okay. It's a bit difficult questions, but the correct answer is B, because when we implement control measures in our ports, and we satisfied that the control measures is implemented, we should issue a control certificate, not a exemption certificate. Okay.
Thank you so much, Dr. Yaya, for providing that answer, and thanks to everyone who responded. It's fantastic that after 3 hours, you still have almost 500 people still, well, 450 now, still online. This has been a fantastic webinar, but it is to be continued tomorrow. But with that, I hand over the floor to Dr. Ninglan for closing today's webinar only. Please note, we expect to see you tomorrow again for more exciting stuff.
Yeah, thank you so much, Supriya and the colleagues and the WHO colleagues and our facilitators, and also the most important to our audience. Oh, sorry. Okay. To our audience, and I think that we are so impressed, including my director. She just told me that we're very impressed by the strong turnout of the audience, even after 3 hours. So we really appreciate your participation, active discussions, and also sharing your experience in the chat, asking the question in the chat. I really appreciate that. And today we have heard from the WHO teams and our experts from the countries to share the legal aspects, instrument requirements, and the country experiences. This definitely shows really this area of work continues to be a very essential and high demand of the topic, because we can see from the turnout of the audience. So we learned a lot how to interpret this legal instrument and the technical principles from global level into your country level, into the real world settings. So tomorrow we're going to have more this type of hands-on experiences and more specialized technical topics. So we really appreciate today's your commitment, and we will expect more tomorrow. Before I close, I wanted to also to say special thanks to our colleagues from Netherlands, UK, Greece, our clubbing center, and Turkey and Morocco for your time and your continued support. We really look forward to your participation and to see you all tomorrow. Thank you very much.
Thank you. Bye. See you tomorrow.
Thank you. Bye.
Bye.
Thank you, everybody.